Welcome back. Now, tonsillitis is a common yet often misunderstood condition that can affect both children and adults, causing discomfort and in some cases serious complications if left untreated. Now, joining us today to provide expert insight is Dr. Suzette Mbanga, a general practitioner at Elite Care Medical Center. Good evening and welcome.
Good evening.
Lovely to have you back with us.
Lovely this side as well.
I don't think there's anybody that doesn't know what tonsillitis is, but in the event that there is somebody that's unfamiliar with this, briefly explain what tonsillitis is and what part of our bodies it affects.
Okay. So basically, tonsillitis is the inflammation of your tonsils, which are located, two masses of tissue which are located at the back of our throats, both on the left and on the right side. On the right side. Yeah.
And what are the most common symptoms one experiences once tonsillitis begins setting in?
Okay. The most common ones are sore throat, which can be mild or severe, fever, headaches, joint pains, cough, runny nose or congested nose.
So almost like a flu.
Yes. Yeah. Body aches, and like those. In children, mostly we see stomach aches or diarrhea, vomiting and nausea. Yeah.
What causes tonsillitis, Dr. Mbanga?
Well, it can be caused by a viral infection or a bacterial infection. Yes.
All right. And how is it typically diagnosed? I would assume it might be a bit tricky, seeing that the symptoms for adults are very similar to flu symptoms.
Well, what we do a physical examination by inspecting the tonsils. So your tonsils will generally be enlarged and inflamed, reddish, or have a whitish or yellowish coating or covering. Yes.
And what are the treatment options that you provide for tonsillitis, or does it depend on the severity of the situation?
As I mentioned when you asked on the causes, so in terms of bacterial causes, we treat it with antibiotics. And for the viral tonsillitis, usually we just treat the symptoms because antibiotics do not work on viral infections. Yes, we'll just treat in terms of fever. We can use paracetamol, ibuprofen to lower the fever. And then for the cough, we treat the cough, depending on what symptoms you present with. For the sore throat, you can do gargles, or we can give some numbing medication to numb the pain in the throat. Yeah.
So home remedies and self-care medication is not recommended for this one?
For the viral one, yes, it can be recommended.
Okay.
Yes, because we don't treat it with antibiotics. Especially if it's mild, you can usually just do your symptomatic treatment at home. Yes, for the fever, you can use your over-the-counter paracetamol, or you can do cold compresses to bring the fever down. You can do salt and warm water gargles for the sore throat. Yes.
So you can treat it if it's a mild case?
Yes.
All right. Yes. Is tonsillitis contagious?
Tonsillitis in itself is not contagious, but the viruses or the bacteria that cause it, the infection itself is what is contagious. Yes.
If left untreated, Dr. Mbanga, what are the possible complications that can come from recurrent tonsillitis?
Okay, the most common ones, just to mention a few, is what we call a peritonsillar abscess, which is a collection of pus around or next to your tonsil, and otitis media, which is the middle ear infection, or lastly, tonsil stones. Yes, some collection of its bacteria that hardens. It forms sort of like little whitish or yellowish stones that are found in the pockets, of the tonsils.
All right.
Yes.
Well, any final advice that you'd like to leave our viewers with this evening?
Yes, because it can be, especially the bacterial tonsillitis, it can be the one that is severe. Yes, it's the one that presents with the most severe symptoms. So I would advise my viewers and the public, if you do have a severe sore throat that's not clearing in 2 days, that's causing you pain when you swallow or when you eat, a high fever, general body weakness and pains, vomiting, nausea, please come to me.
Rather go to the doctor.
Yes.
Dr. Mbanga, thank you so much for joining us once again.
Thank you for having me.
We'll be right back after this brief break. Stay with us.